review some items that you have on your birth plan.
Okay. Moving around prior to giving birth, I assume, is
Well,
normal.
we encourage position changes because that just kind of keeps the baby from really sitting in one position and not coming down true into the pelvis. So we do try to get you, even if you have an epidural, to turn from one side to another,
Okay.
you know, within an hour or so. And you are able to walk around prior to, you know, but if
Just
you're
within the unit, just kind of...
Absolutely, absolutely. We encourage any kind of activity, and you're able to walk to the bathroom as long as you don't have your epidural. So we do encourage moving around.
When will it come a point when, you know, of course I think a lot of people come in here with the intention of laboring, having a natural vaginal delivery, but when is that conversation approached as far as you need to have a cesarean?
Well, there's several reasons you have a cesarean. One is failure to progress, and that's at the end of probably a time period where the physician has evaluated you for several hours in a row and you haven't changed your cervix. Another is when the baby doesn't tolerate labor, and we can go at that time, the doctors will consent, shave a little bit of hair off, place a catheter, probably in the OR, and we roll. You get two...
And that's again right
across through, you get two pre-op medications through your IV that are antacids, and then when you drink, and all pretty quick.
And your husband's...
He just puts a little, we call it a bunny suit, and he dresses in or a painter suit, and he comes in there, puts a little hat and mask on, and he stays at the head of the bed with you.
Okay. And are you completely out during that time?
No, we use your epidural, your labor epidural, or we put a spinal on really quickly. We really try to not to put you to sleep.
Okay.
Because that anesthetic goes to the baby also, so we have to move too fast for that. So.
And is that still possible to breastfeed immediately after?
Absolutely. Well, not breastfeeding immediately after, like when the baby comes out.
Right.
We have to finish the cesarean section, make sure all the closure is completed, get your dressing on, get you into the recovery room, and then we'll have you breastfeed there.
Okay.
Okay.
Let's see. As far as circumcisions and things of that nature, when does that happen?
That happens, okay, once, if you're doing family-centered, say you have a vaginal delivery and the baby's going to stay with you the entire time, we do something called family-centered care here, where we do the birth, the assessment on the baby, keep the mom and the baby as a couple, and we move the couplet over to the postpartum unit. Now, the next morning is when the physicians have an opportunity to do the circumcision. And what they'll do is they'll consent, they'll explain, they'll bring the baby over to the nursery and do the circumcision over there. And so they'll be there's going to be dialogue over here after you give birth, and there's going to be conversation prior to the circumcision itself by the physician group.
And just in my experience of reading blogs and listening to friends, breastfeeding can be difficult, challenging, a long road.
Yeah.
How is your staff equipped to help moms, and what's their knowledge base?
Well, all of our labor nurses are pretty well equipped. The majority of us are childbirth educators, and we have several lactation consultants who are actually on staff here. But we also have gone through an educational program called Bravo Breastfeeding, and it was like a 6-hour educational module, and then we had to do a check-off. And so every nurse in the whole perinatal department has gone through that. But we also are very compassionate about making this work, and so we have a full set of lactation consultants on board. And so if there are any issues that the nurses can't troubleshoot and get that baby latched on, then we have the experts come in to help with that.
Okay, wonderful.
Yeah.
Another concern is epidural placement, and when is it too late? How does that normally play out?
Okay, generally when you're in early labor, you can use comfort measures that are really, an epidural is not necessary. But if you've got an induction, or you're like around 3 or 4 centimeters and you're just feeling exhausted, that's a time that epidural is terrific. Well, at Medical University we have full anesthesia staff around the clock that you just got to let us know when you're feeling like this is hard for you. Now, we also have the capability of placing it up until the time that you're getting ready to deliver. If you're 8 or 9 centimeters when you come in, if you are able to sit up and this is your first baby, and we know that you still may have several hours, we'd be glad to place that. There's no time frame that you can't get it. The only time that they generally won't put it in is if they know that this baby is like, if you've had multiple children and this baby's descending quickly, and you know that you're going to be able to birth this baby before you even could get the epidural in.
And is there a way that, I'm assuming an epidural, the only thing that I can relate it to is getting Novocaine in my mouth for a tooth procedure, but does it numb the whole area? Is there a way you can back it off? Is there a way you can just get a light epidural or heavy
Well,
epidural?
this is how epidurals work. Okay, because you're first sitting at the side of the bed, you get the epidural placed, and they give you something. They give you a pretty dense block initially, just to kind of bring that level up, and that it kind of gives you a break. It kind of lets you kind of catch your breath again. And that dense block will stay for about an hour and a half. But in the meantime, what they've done is they've got this tubing that kind of comes out of your back. It's taped real well, and they have a pump. And so the medication that they're giving you on the pump is going to give you more of a nerve block instead of a motor block. So you'll still be able to move, and you'll feel some pressure, but it won't be that dense heaviness that you had initially when they gave you that first bolus of medication that's going to wear off after several hours. Now you'll still be comfortable, but you'll have some, there'll be sensation, but not pain sensation. So
you'll still be able to feel to push.
you'll feel to push. You're able to help with that a little bit. You're able to lift your legs a little bit more, and sometimes you're even able to use the bed pants and avoid a catheter.
Okay.